So I want to ask you, why are you so convinced that NPD is hereditary and that it isn't caused by childhood trauma, exposure, abuse?
Yeah, I mean, that's a great question. I kind of want to speak to what hereditary refers to first.
Okay.
So there's a difference between um, heritability and inheritability. Okay. So usually when people talk about something being inheritable or hereditary, they're talking about a transmission across a particular family line, right? So things like cancer, things like a propensity to gain weight,
Mhm.
height, right? Eye color. These things
Yeah.
are kind of transmitted straight from your parents' DNA, right? I don't think many people contest that. So, but when I use the term genetics, genetics actually refers to differences in DNA. That's really what it means. It doesn't mean family differences. It means human differences in DNA, right? So we're all like 99.9% the same, and there's a tiny little percentage of DNA differences. Those often happen like the lottery, right? The moment of conception, we get a mixed bag, and then we get all kinds of developmental variation that could potentially make somebody more at risk for any kind of a condition or a disorder, or make them resilient to not getting the disorder. So I don't want people to kind of panic and think if I married somebody who, for all intents and purposes, 20 years has been systematically abusing me and eroding my self-worth, and I have children with that person, does that mean that my kids are carbon copies of that? That's not what it means, okay? Just like we see with ADHD, with autism, two parents without that condition can give birth to a child who has it, right? And so we also need to realize that things like NPD, what we're starting to realize now is they operate on a spectrum or a continuum of severity, frequency, intensity. So not everybody is, even though it would be convenient, not everybody is cut from the same cloth. There's no such thing as a narcissistic gene. There's no such thing as a borderline gene. There's no such thing as a combination of genes that it's packaged together and delivers a card-carrying narcissist. That's not how it works. So I just want to make that clear. We're talking about differences in the DNA sequence, and that's the same with depression too. If you get thousands of differences that together have, or separately have very small effect, but together create a very large effect, you're going to be more at risk for developing something like depression. It's the same thing with narcissism.
Yeah.
Okay. As far as the question of why am I claiming that, or sharing research, it's not even that I'm originating this idea, but why am I sharing research that shows that there's a heritable component to this disorder? Well, because if you work in a clinical setting, and any therapist who's worked with personality disorders will vouch for this. When you work in clinical settings and you don't just meet one or two narcissistic people, you meet lots of people who are narcissistic or personality disordered. Not necessarily because they're coming to treatment because they have a personality disorder. They might be coming to treatment for substance abuse. They might be in an intimate partner violence program. They might be in a treatment center, a residential center. They might be mandated to come to therapy. So you encounter them. They just don't come in saying, "Hey, I'm a card-carrying narcissist." But you meet hundreds of them in different settings.
Yeah.
When they come in, a lot of them report no history of adversity or trauma. And then oftentimes you interview their families because they might they might be incorporating their family into the treatment, and they all unanimously have the same story, that there's no adversity with this person, yet they meet the criteria for a personality disorder. So our research has shown us that trauma is neither necessary nor sufficient in a diagnosis of a personality disorder, because there are just as many who don't have childhood adversity as there are who do. So then we have to go back to the drawing board when there's people who don't have adverse childhood experiences. Now, the counter argument that I get a lot to that is, well, they did have it. It was just unconscious and repressed, and so they don't know that they were abused. Okay, that's not a testable theory, and any theory that's not testable is not a valid theory.
There you go.
You can't go the Freudian route of if you don't have it, it's because it's unconscious, so you don't know you have it. That's not science. That's silly. Okay, so that's not a theory that can be, held up as any sort of a testable method. You can't say that the people who say they don't have it just don't remember they have it because they repressed it. That's the only, that's one of the main arguments I get that's pushback. But the reality is this: there's studies based on a very natural experiment that's kind of really fascinating in identical twins being raised apart. And when we can study twins raised apart, regardless of social environment, regardless of family environment, we can determine how much of their personality is influenced by genetic factors, because they didn't have the same upbringing or the same parents or the same socioeconomic status. And the concordance rates of these traits, the percentage of the time that one twin has it and the other twin has it, they are sky high as far as percentages. We're talking upwards of 70% plus in twins who didn't even know the other existed. And if one of them has the disorder, the other one has the disorder, sometimes up to 77% of the time, 79% of the time. There's twin studies out there that can verify this. I'm not making these numbers up. So they've also done something called meta-analyses, where they've measured, they've done a study of studies, thousands and thousands of studies, millions of participants. So we're talking about a population sample of millions of people, and tens of thousands of different traits were assessed and studied. And on the lower end of it, we're talking the low end, 50% of differences in personality and in psychology in general are attributable to genetic differences. Period. I mean, you can argue what that data means, but it is what it is. There's just no way to contest that. Does childhood trauma matter? Absolutely. Is it necessary for the development of a personality disorder? Absolutely not.